Good evening, everyone. Oh, you can really, that's good sound. My name is Robert McDonald, and I'm from the Lung Association of Nova Scotia and Prince Edward Island. And I'm happy to be here tonight representing the Chronic Disease Advocacy Partnership. I want to start by welcoming, I want to start my welcome by acknowledging that the land on which we gather is the traditional and unceded territory of the Abegway Mi'kmaq First Nation. We convey our respects to all Indigenous people living in this region, to the knowledge keepers, and to their brave and resilient leaders, past and present. I'm very excited to see the turnout tonight, and this is excellent. I know there's been a lot of forums and debates going on over the last couple of days, and it's been a quick turnaround of an election, and the fact that we got this in person off the ground is really should be attributed to Judith Kays, and I want to thank Judith for doing all the work. She's a transplanted islander. She lives in Nova Scotia, but she always tells me her heart is here. So I also want to say a special thank you in that regards to the candidates themselves for really agreeing to, again, on short notice, to the conversation tonight. And we all see them here: Marcia, Michelle, Tristan. I didn't get to meet Tristan up there, but Tristan, nice to meet you. And Zach, I had a chance to say hello to Zach as well. The reason why we're here tonight is to discuss chronic disease. It's a very important issue to a lot of health charities and to the general public, and that's why, again, we're having a great turnout tonight. 87% of Canadians will likely be affected by a chronic disease or major illness in their lifetime. The challenges and issues surrounding those living with chronic disease are important topics that need to be addressed. What a better time than during an election. We're hoping that this evening's discussion will give us all some insight into what is happening now with healthcare and PEI as it relates to chronic disease, and what needs to happen and how we can all work together to make it happen. That's really the key. We need to work together to make progress. This forum is an initiative of the Chronic Disease Advocacy Partnership that I just kind of mentioned, and if you go online, you probably won't see it. It's really just a collaboration of like-minded charities in the chronic disease world, and it started in Nova Scotia, and a lot of the charities are responsible for multiple provinces, and it's just a natural to see it grow here in Prince Edward Island, and we have reps that work here on a day-to-day basis, and I see one over there, Sarah Crozier from Heart and Stroke, who's been a big help as well in getting this together. I will quickly name them off, the organizations, and then we can move on to really get me off the mic here. But Arthritis Society, the Canadian Cancer Society, Canadian Association for Retired Persons, Diabetes Canada, Heart and Stroke, Lung, MS Canada, March of Dimes Canada, Parkinson's Canada, and the Sclerodoma Atlantic. Again, thanks to each of you for coming, and to the many other interested and stakeholders and special guests we have here tonight. I also want to say thank you to our corporate sponsors for supporting this initiative: IMC and Boehringer Ingelheim. One small reminder: please turn your cell phones to silent. And however, if you're on social media and would like to share your thoughts and photos this evening, I encourage you to do so, and please use hashtag PEI POLI, Polly. I'm not a social media person myself, so I stay off it. It's only trouble. Now I'd like to introduce our moderator for tonight. Don Binns is co-owner of island-based marketing agency Insight Studio and an experienced facilitator, having worked with businesses and organizations across the region and country. I like to call her actually our savior, because our original moderator canceled this morning on us, unfortunately, due to unforeseen circumstances. So she came through in the clutch, and thank you very much, Dawn. She has extensive experience in the health promotion and chronic disease field. She spent over 7 years with the Canadian Cancer Society, working provincially and nationally on important chronic disease issues, such as access to medications, chronic disease prevention, and tobacco control, just to name a few. Dawn has been a strong advocate for collaboration, chairing numerous organizations, including the PEI Healthy Living Alliance, and co-chairing the launch of PEI's first cancer control strategy. Dawn describes herself as someone who's passionate about public policy and the impact it can have on people's lives, making her an ideal monitor for our discussion this evening. Dawn?
I'm not quite as tall as Robert, so I'll just adjust that so slightly. So good evening, everyone, and although I may not have been first choice, and the first choice was a very good choice, I have to say, I do know who it was, but I am very happy to be here this evening. It was a bit of a homecoming and an easy yes when I was asked to come and moderate on behalf of these various organizations that are still near and dear to my heart, and the impact they can have on the island, and the policies and the programming that you can do. So thank you so much for having me. Chronic diseases are among the most common and costly health problems facing Canadians, and in fact, approximately 77% of us here in Prince Edward Island live with at least one and often two chronic diseases. Some feel that the needs of the people with chronic disease are too often not met, and that the healthcare system in this province needs change and specific actions. That's why we're here tonight, to talk about these issues and to learn more in order to make a more informed choice on April 3rd. Yeah, right. I'd like now to introduce our candidates for this evening. Representing the Green Party, Michelle Beaton, the candidate for District 5, Mermaid Stratford. Representing the Liberal Party, Marcia Carroll, candidate for District 11, Charlottetown Belvedere. Representing the New Democratic Party, Tristan Mitchell, candidate for District 9, Charlottetown Hillsborough Park. And representing the Progressive Conservative Party, Zach Bell, the candidate for District 10, Charlottetown Windsor. Thank you so much for all of you coming here this evening and being a part of this. So just to let everyone in the room know, here's how things are going to work this evening. Each candidate will have 2 minutes for an introductory statement. Prepared questions will be asked of each candidate, and they will have 90 seconds to provide their answer. There will be an optional 30-second rebuttal at the end of each round of questions, optional. And at the end of the prepared questions, I may have a couple impromptu ones for candidates, but if we have time, we will be opening it up for questions from the floor. So if you want to take note and think of anything you might like to ask our candidates, we'll hopefully have time for that. And at the end of the evening, each candidate will then have 2 minutes for a closing statement. And we'll be keeping time throughout the evening, so please, candidates, respect each other's time. When you see the yellow card and our lovely assistant at the front, you'll have 20 seconds to finish up. And if you see the red one, that means stop. And I do have a bell, but I really don't like ringing them. I feel very awkward when I have to ring a bell, so let's hope I don't have to do that. I'm not thinking we'll have to. So, the healthcare organizations that Robert referred to a few moments ago, that Robert referred to, came up with some overarching questions that are relevant to the people in PEI who are affected by chronic disease. And our candidates have received these questions in advance. And so we'll start first by inviting each candidate to deliver a 2-minute opening statement. And we will start with Ms. Beaton. I'm going to mix it up.
Turn this on.
It's on.
It's on. Okay, can you hear me? Okay. All right, I just saw the button hit. I'm not really good under pressure when it's timed, but anyway, I will be fine. My name is Michelle Beaton. I've been the health critic for the official opposition for the last 2 years, and I've had the privilege of representing the residents of Mermaid Stratford since 2019. I have learned so much as being the health critic. I've had the opportunity to work with many in the room who have been fighting for the rights of people that are living with chronic illness. And I really think that that has informed our platform, and I do know that it's informed some of the work that we've done in the legislature. We have been great advocates for through different motions and questions in the legislature, whether it has been for cystic fibrosis and drugs, whether it's been for diabetes and funding initiatives, including continuous glucose monitoring and removing age restrictions, endometriosis awareness and long COVID, asking for a clinic, and the shingles vaccine, and we've also worked on ovarian cancer. And so many chronic illnesses require a really cohesive plan, and unfortunately, this island doesn't have it. We don't have a cohesive plan that addresses all of those integrated illnesses that a person with chronic illnesses can be experiencing all at the same time. And so that's a challenge. And what we really need to do is focus on funding for preventative measures. We need to address where the gaps are in the system. And I really look forward to working on building that plan, because unfortunately Islanders living with chronic illnesses has been let down because we don't have that cohesive plan. And I think that's where we need to focus on and move towards. Thank you.
Thank you very much. And we will move on to Ms. Carroll.
Okay. Hi, everybody. Welcome. I see the mayor over there. It's good to see you tonight. And my old friend Nancy Marie Arsenault's here, so I'm always happy to see her. I don't know where she went. There she is. And Leo Shivery. I'm using too much of my time saying hi to folks. So my name is Marcia Carroll. I'm the Liberal candidate for District 11. I am the past executive director of the PEI Council of People with Disabilities. So I was in that position for 17 years. So I've worked with many of the EDs that I see in the room today, and you and I had lovely conversations about how we can address chronic disease and disability at the same time, because they're so closely interlinked. A couple of things that I'd like to bring up is that our current accessibility support program, which has gone through extensive changes, still does not recognize chronic disease as a disability, and that's a huge gap in services. How we finally got them to recognize mental health as a disability and being able to be supported under that program is go to the Supreme Court. So I'm hoping that they'll see the wisdom in what we say here tonight, and maybe Zach can bring back some recommendations. Before I got here tonight, I took a call from a constituent who was a vet, and he was hurt while serving this country, and now he has 4 chronic diseases. One of them is epilepsy. He has such strong seizures that they rip his muscles, and he's been told that it will be 9 years before he sees a doctor. Before he'll have a family doctor, I should say. He's been out to the ER and whatnot and gone through the various channels that have not worked for him. That's why I'm a politician right now. Sorry. That goes by fast.
It goes by fast. Thank you very much. And
I have more to say, Miss.
we've got the whole evening. And we'll turn over to Mr. Mitchell.
Good evening, everybody. I'd like to thank the organizations that were integral for putting this together today. I think that healthcare, we know, is at the top of all Islanders' minds coming up in this election. My name is Tristan Mitchell. I'm a paramedic and 911 officer here in PEI and running as the NDP candidate in District 9, Charlottetown-Hillsborough. At the age of 21, and as one of the 2 youngest candidates in this election, the other being Aiden Mousavian, who joins us today from District 11, Charlottetown-Belvedere, I see myself as a voice for my generation. As an aspiring young healthcare professional, I'm concerned about the direction that our province is going, especially when it comes to things like healthcare. Privatization is on the agenda of many of the parties seated here today, and we know that the risks involved with putting a price on people's health isn't rewarding. For those living with chronic disease and those interested in growing old in our beautiful province, It's essential that we invest into a healthier future. This is needed for all Islanders today and tomorrow, and that's why I stand here today with Team NDP fighting for a better deal for all of us. Thank you.
Thank you very much. And our final opening statement, Mr. Bell.
Thank you, Dawn. Good evening, everyone. My name is Zach Bell. I'm the PC candidate for District 10, Charlottetown-Winslow. I do want to thank the opportunity to be here. Thank you, Dawn, and of course, Marcia, Michelle, and Tristan. Just on behalf of the PC party here in PEI, it is a pleasure. And again, I do see some familiar faces in the room, and I'm hoping to get to see some new faces and meet some new groups here tonight. And I do want to thank, the great thing about being here this evening, is we have some other candidates here as well, and some advocates. I say hello to Hunter and to Nick, and I do say hello to His Worship Mayor Brown and Aiden. It's great to see so many people that are here and involved. One thing that Tristan and I talked about very quickly is the opportunity to go out and hear what people have to say, because again, I can try to tell everyone in this room what you need, but at the end of the day, I want to listen to what you have to tell me. I've had the opportunity, it was a great opportunity with Michelle to sit on the Standing Committee of Health and Social Development. We got to hear from some amazing people and some of the struggles that they go through, and Hunter was one of those who presented extremely well, and you know what I mean? And thankfully with every party involvement, we were able to make some changes and bring some changes about. So I think that my time's going to come up here very shortly, so I just wanted to thank again all the organizers. I want to thank all the groups that are here tonight, and I want to thank all the candidates as well. Thank you.
Great. Thank you very much. So we'll move on to our first question. Chronic diseases are among the most common and costly health problems facing Islanders and Canadians in general. On many public health measures, people living here are rated among the unhealthiest people in Canada. Along with social determinants of health, this province has some of the highest rates for modifiable risk factors, such as inactivity, poor eating, obesity rates, and smoking. The question is, what will your party do to address this growing health burden and to help prevent the increasing prevalence of chronic diseases? And to switch it up, I'm going to start with Ms. Carroll.
Okay, so the name of our platform is Healthcare First, so that in a nutshell kind of says it, but specifically around chronic disease, we would double spending for health promotion grants to expand promotion of healthy living, and how do you do that in a way that is affordable, and that money would go out to NGOs so that they could support the people they know are suffering with chronic disease. We would allow, so currently right now what happens at PEI is that our pharmacists only practice at about between 60 and 80% of their scope of practice. So we would extend that to align with the rest of the country, and they would be practicing at 100% of their scope of practice. Many pharmacists manage chronic disease. They could deliver PEI smoking cessation and vaping cessation program. They can help Islanders access critical services. They can help with diabetes. They can help with CPOD. And all that can be done by your pharmacist as opposed to waiting 15 hours or 20 hours to see an ER doctor that has no recollection or no in-depth knowledge of your file.
Thank you very much. We will call on Mr. Mitchell for your thoughts on that question.
As New Democrats, we believe in a robust approach to disease prevention as well as health promotion. We know that investing into the social determinants of health, like education, housing, jobs, early childhood development, and primary care accessibility contributes to a healthier population and reduces health costs in the long term. The NDP plan to address chronic health issues and disease prevention includes improving the social determinants of health by investing in things such as improving incomes, housing accessibility, and food insecurity, establishing community health hubs and universal childcare, addressing the shortage of physicians, nurse practitioners, and many other healthcare professionals, And finally, improving access to education programs and activities that support healthy living and disease prevention for all. Thank you.
Thank you very much. And we'll call on Mr. Bell, but to remind you of the question, what will your party do to address this growing health burden and help prevent the increasing prevalence of chronic diseases? Mr. Bell.
Thank you, Dawn. And yeah, I do think that probably everyone at this table would agree that preventative is the most important thing. Some of the things that the PC government has helped to bring to fruition, of course, my wife's a school teacher. She sees this every day. The healthy food lunch program that's offered at the schools. The Children's Wellness Tax Credit for Families has been another great thing, and also the Seniors Food Program pilot, which would provide reheatable meals delivered to seniors at a reduced cost. I wasn't actually in the legislature when it was brought in, but there was a bill brought in by a good friend of mine, Corey Deagle, to get rid of vaping and underage smoking. All parties did agree with that. A PC government, one thing that I'm very happy about would increase the fitness and activity tax credit to $1,000, and that's for artistic or cultural, recreational, physical activity program. Also, I coach a lot of sports. I actually coached against Michelle this summer in softball, but there's a kids sport funding program up to $600 per child to participate in sports. Adding more drugs to the provincial formulary is another thing that the PC government would bring in. Thank you.
Thank you very much. And Ms. Beaton.
Thank you. And he omitted that I won. Or not I, my team won. So, I think one of the biggest challenges that we're experiencing right now is governments have only dabbled around the fringes of what our issues actually are. We need to have transformative changes within our healthcare system and in the way that we treat islanders. So what I mean by that is the social determinants of health. You cannot thrive if you can't afford to put a roof over your head, if you can't afford to put food on your table, gas in your car, or whatever it is that your need is at the time. The Green Caucus promoted a piece of legislation called the Poverty Elimination Act, and that put in very clear measures of how we measure poverty. Because if you're choosing whether you put healthy food on your table or gas in your car to go to your doctor's appointments, or if you're choosing to put fuel in your home in order to heat it versus sending your child to the programs that they need in order to be healthy, then we're not going to succeed. So Greens have committed to a basic income pilot. We have committed to 10 paid sick days. If you're sick, stay home. We've committed to increasing the pharmacare program by $18 million and provide funding to a new strategic plan for the Chief Public Health Office to promote upstream healthcare. Sorry. It was the whole baseball.
It was the whole baseball thing.
Yeah.
So we do have our 30 seconds for rebuttals. So we'll do what I call a popcorn. Anyone who'd like to go first just to start, and but we'll give each of you 30 seconds. Yeah, Ms. Carroll.
Okay. I had the opportunity to present to the committees that both Zach and Michelle sat on around the determinants of health, and we know the number one determinants of health is income. The opposition and the government have studied basic income guarantee, and we've studied it some more, and I do recognize that we need a provincial or a federal partner in order to do that. But what I'm very confused about is that the King government reduced their spending for projects invested in chronic disease management. The spending was actually reduced, and at the same time they underspent the grants that allocated to health promotions. So yeah, just wondering about that.
Thank you. Tristan or Zach? Michelle? Whoever'd like to go next.
Oh,
Yeah.
did you want to?
Yeah, sure, I'll go ahead.
Thank you.
I think that's a great question. I think we've seen some surpluses and there's a question as to why there is cutting going on when we know that healthcare is a priority issue. But you know what, I'm going to swing it back to you, Ms. Carroll, and I'm going to ask, because I took the liberty today to go over the Liberal Party platform, and when we talk about the social determinants of health, I think that housing is a fundamental one, and I'm a little bit concerned about the platform piece where the Liberals talk about removing rent protections and allowing for landlords to price gouge rent costs on vacant units. If we're going to focus on social determinants of health as a goal for improving chronic disease care, I think we need to look at all of them and not just one section of them.
Okay, Mr. Bell, your turn for rebuttal.
I don't get the answer.
We'll get to the next one.
Thank you, Dawn. Just very quickly to, I guess, partially try to answer Marisha's question. I know the Premier and the Leader of the Opposition and Leader of the Third Party were all strong proponents of the targeted basic income pilot here on PEI. And I know that's something that all three parties, I think, would, and PEI, I do think would be a great test subject for that, because again, you hear it at the doors a lot of times that because we are such a small population, but we're still a province, that it could be a good area. And I do think that if Dennis King is successful, that I think he will still continue to work for that. Thank you.
Great.
I would just say to that, show me your budget and I'll tell you what your priorities are, but unfortunately we haven't seen a budget from this government, so we don't actually know if that's the case and that you would support a basic income. The other thing that I'm concerned about is frontline healthcare workers often come forward with solutions because they are the ones that actually care for people every single day and know what their patients need, and too frequently the answer to them is no. And at this point in time, I think we don't have the environment to say no. I think we always have to be saying yes. If we have frontline healthcare workers that are promoting health for their patients, we need to say yes.
Thank you. We do have to move on to our next question. So the rebuttals are in order, and they're the 30 seconds. It's what we've got, okay? Barriers to services for people living with chronic disease or illness, including untimely access to primary care visits, followed up with tremendous wait for specialist appointments, are negatively affecting Islanders' quality of health. What steps would your party take to ensure that healthcare facilities and practitioners have sufficient resources and the corresponding accountability to ensure that no one has to wait longer than the medically recommended wait times for primary or specialist care? And to start this question, we're going to start with Mr. Mitchell.
Well, I am a strong advocate for universal health care, and I think a portion of that in universal health care that's important is making it equitable and accessible. Every Islander deserves health care where and when they need it, and unfortunately access to primary care has worsened from 2020 to 2022. The number of people on PEI's Family Doctor Registry has nearly doubled, and I find myself amongst those 28,000 Islanders asking myself when healthcare will improve. In addition, Islanders are waiting far too long for specialist appointments as well as surgeries. New Democrats are prepared to make the necessary investments to reduce healthcare wait times for Islanders by addressing the shortage of physicians and nurse practitioners, by fast-tracking the licensure of foreign-trained medical professionals, establishing health hubs where primary care teams provide services to individuals in their communities, and ease the pressure on regional hospitals by implementing and hiring physician assistant professionals into our healthcare team roster. And this can be achieved by investing in things like education and taking action. There are solutions. It's all about who's in government to make those decisions and be accountable for them. Thank you.
Thank you. Mr. Bell.
Thank you, Dawn. I do think that removing barriers. When I got into this job originally, that was one of the things that I noticed, and like people would contact me. I'm sure they've contacted Michelle many times, and trying to find out how to get through these barriers. And healthcare is no different. I've heard it at the doors in District 10, Charlottetown, Winslow, and the people that I've talked to. I know that I promote this to every house I go to that I talk to about the patient medical homes, and I do feel that is going to be probably the way of the future for healthcare to try to break down those barriers, and because that's the biggest thing is people are having issue. The people that do have a doctor are having trouble trying to actually get a hold of their doctor and get to be seen by their doctor. So the PC government, you know, and I know that Tristan might disagree with this one, but you know, using apps like Maple is a way for. I've talked to some constituents who lost their doctor, and they're able to use this app to actually get healthcare. So, you know, whether it's getting prescriptions. And some of the other things that this government would do is a virtual hallway program to basically help connect family physicians with specialists for consults and avoid the unnecessary referrals to specialists, because that is the biggest thing, is to try to take away the roadblocks. Thank you.
Thank you very much. Ms. Beaton.
Great, thank you. So it took decades for us to get here. Fragmented inaction. We've seen blue and red governments not have a plan for healthcare, and it's just gotten worse over the last few decades. And we've seen the trigger with the warnings. The flags have been raised high by our healthcare providers. Our platform is a plan for strong public healthcare, and it comes in 4 parts. So getting healthcare at a crisis, that has to be our very first step. We have to get our healthcare at a crisis. That means support our physicians, support the people working at all levels of healthcare in order to do that. It also means getting politics out of our healthcare system. It is something that the Liberals did in 2018 by removing autonomy of health PEI, and then the Conservatives refused to give them back their autonomy in 2021 when my caucus tried to bring forward legislation. We need to value the healthcare workers. There is a culture of silence in healthcare, and there's a toxic work environment that they're working in, and they are not paid their fair wages, and we need to pay them. And we need to commit that we're going to have contracts for our healthcare workers and everybody that is in a collective agreement so that it doesn't expire. We need long-term investment. No long-term investment from red and blue when it comes to public long-term care homes. 60% of the beds in acute care in our hospitals today are being used by people who need a differing level of service. That means they should be in a restorative care unit or a long-term care home. That would free up beds, that would ease the pressure for our emergency rooms. And I'm just going to quickly get in that we need the upstream investment in health promotion.
Thank you, Ms. Beaton. And Ms. Carroll.
Okay, so our party would take a number of steps going forward to address the crisis in our healthcare system. The first we announced today, what we would do in the first 180 days, and then the 2 years, 4 years, and then on to, this is not going to be fixed in 24 months. It took a long time to get here. So there needs to be consultation and engagement with the frontline workers and figure out a way forward. We have done that in our platform, and it's clearly lined out how we will go about doing that. We will increase walk-in clinics, the range of hours. There would be a community emergency center in all the 3 major communities, such as Montague, Charlottetown, and Summerside, where that would be run by a nurse practitioner and a pharmacist, and you could go have your chronic disease managed at that particular center. If you needed to see your doctor or see a specialist, those professionals would be able to refer you to them. If you were presenting at the time that you needed to be taken to the hospital, you would be sent in an ambulance to a hospital. So we would increase spending on all levels of healthcare, in all departments of healthcare where we've seen a conservative government reduce that level of spending. Also, one of the big piece that we would allow anybody who can practice in Canada to come here and practice without there being any barrier to that.
Thank you very much. We'll go through our rebuttals in the same order we took the questions. So, Mr. Mitchell, do you have any rebuttal to add to this? discussion?
Yeah, and this one's going to be directed a little bit towards Mr. Bell. You know, we've had 4 years of Conservative government that came in during the pandemic, which we know the entire international community was focused on healthcare. There wasn't actions taken to support RNs becoming NPs, to bring physician assistants into our healthcare system. There's been delays on legislating for midwives, and it's interesting with this snap election to see big promises being made in 4 weeks when there was no action taken over the last 4 years to make tangible changes now.
Great. Thank you very much. Mr. Bell.
Thank you, Tristan. And you make some good points. And of course, you never like to make excuses or use anything as a crux when you're trying to answer a question. But COVID did take a lot of resources. And one thing that I do think has been a great program. And again, I can only speak for people that tell me what things have been good in the district. But the Pharmacy Plus program was something that was rolled out. And that gives pharmacists a lot more leeway. You probably hear it, we probably hear it with scope of practice, allowing people to do more than they can, because a lot of our healthcare professionals are trained to do things, and sometimes, Marcia talked about it as well, it might be either legislative problems that are holding them back from doing that, so, sorry.
That's okay. Great. Thanks very much, Ms. Beaton.
Well, I can tell you I met with the Premier. It was in September, and I believe it was 2021, and I said, do you know what, you got to get all the healthcare providers in a room together, and you have to work on scope of practice, see where the overlaps are, where we can actually better service Islanders. And it took a year for him to have that meeting. He said it was difficult to get people in the same room. Well, it shouldn't be that difficult to get people in the same room. Healthcare providers have been crying for this for ages. They've been crying to be heard. I also want to address 2 other things. Exit surveys. We don't do exit surveys for people who are leaving the system. That is just the most disrespectful thing ever, and you're not going to let me get the second one in. I'll get it on the next rebuttal. I promise.
You have more rebuttals and closing comments, so hold those things. Ms. Carroll, for your rebuttal.
Yeah. So just very quickly, one of the first promises that the Premier came out with was to buy 4 more ambulances. You can go out to the hospital at any given day and see 10 ambulances lined up because the person in that ambulance cannot get looked at by a doctor. And 9 times out of 10, that person has a chronic disease. And that ambulance driver, as you would know, Kirsten, sits there and sits there and sits there and sits there until that person is looked at. So that very highly skilled professional is taken out of the workforce.
Thank you very much.
I had lots more to say, but she showed me that right curve.
And we're paramedics, not ambulance.
Oh, I'm sorry. Yes, I'm sorry.
Thank you. We'll move to question number 3. With the increasing rates of chronic disease, substantially increasing the cost of healthcare, this rising burden will become financially unsustainable. What will your party do with the financial contribution from the federal government to address the prevention and management of chronic disease? And we will start with Mr. Bell.
Thanks, Dawn. So some of these might be a little bit repetitive, but again, I do think that the biggest thing to do is to work with the federal government, of course, because actually Michelle and I were at an announcement in summer of 2021, I believe it was, about a pharmacare program that would again be specific for PEI. The virtual hallway is another thing that I do think is trying to get rid of those barriers. And the acceleration, I know Marcia had mentioned there, it might not happen in 24 months, but the rollout of these patient medical homes, again, I will say that I do agree with this model. I do think it is probably the way that healthcare is going to go. And I use the example of someone, I said, when we had if we had an issue, we'd say, well, I need to go see my doctor, But I talked to a lady and she said, she's part of the Kinloch Patient Medical Home, and she said, I had to go see my doctor 3 times this year. And she said, but the 3 times I went, I ended up seeing a physiotherapist. So I do think that the patient medical homes will be the way of the future for PEI's healthcare. Thank you.
Great. Thank you very much. Ms. Beaton. And the question, just as a reminder, it's how will your party use the financial contribution from the federal government to address the prevention and management of chronic disease?
Thank you, and I'm just going to simply say I'm surprised that the PC party couldn't actually document exactly how they spend the $48 million that they just got, seeing that we're now into a budget. But how would we spend it? $37 million in increasing wages for frontline healthcare workers who were completely ignored by the Conservative government when they put out an $8 million bonus, which was divisive and left so many healthcare workers out. We would actually increase those wages because, let's be honest, we pay our healthcare workers less than Nova Scotia and New Brunswick, and we are losing people hand over fist. We need to keep them in our healthcare system. That means we have to retain them, we have to pay them, and we have to treat them with the respect that they deserve. We would also invest $18 million into our drug formulary because we are the most underfunded drug formulary of the country until recently when the federal government gave us an influx of funding. They did that because we were so poorly funded, and that's been happening year over year for a decade or more. So we would spend we would increase that by 18 million, and we're actually the only ones that are addressing that issue. That's bringing us closer to universal pharmacare. And also what we would look at is we would we would fund our CPHO because the Chief Public Health Office is very underfunded. That's where our health promotion comes from. If we really want to measure the health of Islanders, we need to make sure that the Chief Public Health Office, who does the upstream, sorry, I got distracted, now I'm out of time, does the upstream work, that they are well funded, and we have to put the money into that as well.
Thank you very much. When that red card goes up, it is a visual thing for our speakers, so I do appreciate that for sure. Ms. Carroll.
We would start off by spending $92 million in the next 3 years on healthcare. I just need to tell you a quick story. My family interfaced with the healthcare system because my mother was sick and needed to go into a nursing home. And I have to stress this fact, that it's not the people working in the system that aren't doing a good job. They're working hard, they're compassionate, but they're under-resourced and overworked. Nurses can't get vacations or have days off. There's no work-life balance if you choose a life in healthcare. There just isn't. So our party would spend $92 million over the next 3 years on healthcare. We'd invest heavily in the retention of our healthcare workers and bring in supports for them like counseling and appropriate human resource management so that people get the support they need in their jobs. Invest in Team PEI nurse scholarship, so we would increase the LPNs, RCWs, RNs, and nurse practitioners in our systems by waiving all tuition for that group of individuals. And again, giving that bonus to one group of people, I hear it over and over and over at the door. It was a slap in the face to the rest of the system, and everybody tried to have that changed, and even with a strong opposition, that couldn't be done. Increased spending on medications, like Michelle said, we are the lowest funded formulary, and we'd increase it by 14 million.
Thank you very much. I know. So we still have the rebuttals. So Mr. Bell, I'm going to go back down to you. Oh, sorry, Mr. Mitchell. I just checked your... I knew I was going to do that at least once.
That's okay. The Democrats are often forgotten about, and that's all right.
Never.
Yeah, so, I will first and foremost by saying that as a healthcare worker and as a taxpayer here, I believe in spending island public tax dollars on island systems for island needs. We know that people living with multiple chronic conditions need ongoing access to primary care and social supports. The community health hubs would meet this need with the comprehensive services that support the whole individual and their needs. And we're committed to establishing these health hubs where health professionals such as physicians, nurse practitioners, psychologists, and dietitians work in conjunction with social workers, counselors, addiction workers, and appropriate support staff to provide individual plans tailored to the individual, addressing their multiple health-related issues. And these are also going to be places where community groups and NGOs can also engage with patients in providing them alternatives and support for their care. Just as it takes a village to raise a child, it takes more than a doctor to help Islanders improve their well-being, both mentally and physically. With teams of knowledgeable professionals, well-rounded care will improve the lives of those living with chronic diseases and hopefully reduce the risk of development of chronic diseases in at-risk patient populations.
Thank you very much, and not forgotten. So we will go to our rebuttals. Mr. Bell, we'll start with you.
Yeah, I don't really have much of a rebuttal. Tristan, you're the healthcare professional here, and I think you made a very valid point there in your argument and your answer to that question. And I like your line about it's not going to just take a doctor that's going to help solve the healthcare crisis. It's going to take that team. So I just wanted to say thank you. Yeah, that's it.
Thank you very much. Appreciate that, Ms. Beaton.
Sure, the one thing that I'll add, so mental health services are not actually supporting people the way that they need to be supporting, especially those living with chronic illness. One thing I did learn on this campaign trail that I didn't realize was people who suffer with, after having heart surgery often fall into depression, and it's something that's known, but yeah, we don't wrap the support services around them. And I think that we too often try to separate mental health from whole health, from your physical health, but the two have to be healthy in order for you to be healthy. And I will just say, separating mental health out, there's a stigma to that, and we have to stop having that stigma and labeling people with it.
Thank you very much. Ms. Carroll, anything else to add?
Yeah, so one of the things that I would say really quickly is that mental health is very much connected to physical health, and I disagree with Michelle. I think the two should be separate. I think mental health and addiction should have its own department, and it should be funded appropriately and given the weight of its own ministry, because it is a chronic disease and we need a lot of help in that area. We would also increase spending by $6.6 million in housing, because if you use a housing first philosophy, then you are going to start to help people move forward through their journey of chronic illness.
Thank you. And Mr. Mitchell?
I think that it's really important to note the fact that in Canada for a long time we followed in the steps of the United States and treated healthcare as sort of a final care step rather than investing into the social determinants of health and creating healthcare that is a system that will prevent people from developing those chronic conditions. And I get concerned, when we throw money into private corporations as well as these so-called retention bonuses, which are really PR stunts that are taxed at 46% and don't retain anybody. We need to think about tangible solutions to approach these problems and invest in our future.
Great. Thank you very much. So we have one more of our prepared questions, and we will go to the floor, and just so you can all prepare, and you don't have to line up yet, but just get you thinking. So our last prepared question is: a large number of Islanders have multiple chronic conditions, multimorbidity, with about 20% of the population experiencing 3 or more chronic conditions. What steps would you take to ensure people with multiple chronic diseases and illnesses are supported and have access to programs that would allow them to be fully engaged in society and enjoy a better quality of life? And for this one, we'll start with Ms. Beaton.
Great, thank you. This is a great question, and I think I referenced it in my opening statement when I said we do not have an integrated healthcare system that would allow all chronic health illnesses to be kind of looked at from a holistic point of view. So one of the big things that I'd like to just point out is often navigating that system and advocating for yourself falls on the shoulders of somebody who's sick. And I spoke with a nurse not too long ago while on the campaign trail who advocates for people who are living with chronic illness, and she said one of the big issues with equity is having somebody who lives in Tignish have to travel all the way to Charlottetown for radiation treatment out of their own pocket. And I really think that we need to realize that the cost of having chronic illness is substantial. And what I really would like to see is having somebody as a navigator to help navigate that system, because when you have multiple chronic illnesses, you're going through multiple separate systems. People try to help you through it, but to have somebody who is more of a navigator that can break down those barriers for you is going to be really important. And I also have to address the loneliness of having chronic illness. loneliness is just as detrimental to somebody as smoking 20 cigarettes a day. And we don't actually address the loneliness in our community, and that is something that we need to do, and to be able to connect people, knowing that when you live with chronic illness, you still need to be part of the community. So how do we make this community issue rather than it falling on the shoulders of somebody living with chronic illness? Sorry.
Thank you very much. Ms. Carroll.
Okay, so I chatted with a nurse the other day, and they told me that I forget if I told you this story already, but I'll say it again. That doctors are to diagnose disease and create plans to treat that disease. Everybody else below the system should be implementing the plan that the doctor has laid out. Instead, we have doctors who are stitching up fingers. We have doctors that are checking on sore bellies. So, it becomes, the system then becomes, how do we design a system that is functioning really well so that you don't need a navigator? Like, my dream is that, like every system we have in government, we need a navigator for. Why don't we create systems that are so simple that the average person can use them and not need a navigator? That should be the way it works, but it's not right now. Our healthcare system is extremely complicated. I ran a large NGO for years for people with chronic illness, and when my mom got sick, I was challenged to navigate that system. I felt like calling Carrie and saying, "Can you help me?" She was a girl that I used to work with. So it was, it's a complicated system, so we need to increase our nursing spaces and our LPN program so that we can have qualified people dealing with chronic disease and not people trying to figure out how to do it themselves.
Thank you very much. Mr. Mitchell.
Well, I think this question definitely ties in with the last one on where we put federal spending. Increasing rates of chronic disease are definitely connected to poor government decisions, such as failing to invest in affordable housing, poverty reduction, and what we all know that's really scary is the underfunding of our healthcare services. We know that with PEI's aging population and the prevalence of chronic diseases, healthcare costs are going to be more considerable in the coming years, and that's unavoidable. However, if we make needed, responsible investments today, it's going to make healthcare more sustainable in the long run, such as creating those community healthcare hubs and investing in young people seeking to join the healthcare workforce. We can improve the wellness of PEI's population through taking our provincial budget and putting it into things such as school food programs, raising social assistance rates, improving wages, and creating real affordable housing. The results of these investments will be tangible even within a few years and will absolutely help offset the costs of healthcare. An individual that has the support to live a well-rounded, healthy lifestyle will be less at risk of developing chronic disease, and those investments would also help people who are at risk for developing them. So I think it's important we spend responsibly and we look at more options than the options we've been trying for decades and decades. Thank you.
Thank you very much. Mr. Bell.
Thanks, Dawn. And yeah, I think that kind of goes back to the first question that was asked too about preventative being probably the name of the game, right? Like a lot of these programs that Tristan mentioned them as well, but some of the things that PC government, if re-elected, would really try to work on is to expand the restorative care services, work with PEI Speech and Hearing Association to reduce wait lists and the service gaps, with adding like new speech pathologists and audiologists in the public health system, adding 50 new positions to public home care over the next 2 years, and I mentioned it before, but adding to the provincial formulary to help that grow. Thank you.
Thank you. Making time for some rebuttals. Any further comments, Ms. Beaton?
Yeah, of course. Don't even know where to start. Like when we talk about where we're going and making a better healthcare system, like we've had decades to do this, and the complexity of our healthcare system was created by both a red team and a blue team. And I hate to keep pointing fingers, but nothing has been simplified, so therefore you do need to help navigate until you can simplify the process. But our government hasn't done that. when you ask people, you know, you talk to people about what services are available, by and large, folks out there in the public don't know what's available unless they're working with the community organizations that are sitting in here in the room. You're solving the problems. It's not government. Government's making it more complex.
Thank you. Ms. Carroll, any further comments on that?
Yeah, I guess I would just like to add that, you know, expecting chronically ill people to navigate and work through a system that is not simplified is an unrealistic expectation. And we can go back and forth of who created it, but we've had an opposition, we've had a government for 4 years that had not simplified those systems at all. So I would challenge both those parties to do that as we move forward.
Thank you. Mr. Mitchell, anything to add?
Avoiding the red flag party, you know, I'm not surprised from the Conservative government funneling public tax dollars into private corporations like Maple Ap, which you brought up earlier, which I absolutely don't agree with. But I'm really surprised that the Progressive Party, known as the Greens, Michelle, is also committing to putting more public taxpayer dollars into that for-profit company owned by Galen Weston to make it free. It's one thing if it was owned by the public, but our healthcare system here is in dire need of investment and resources, and funneling it into the pockets of Toronto corporate pockets is not a great solution.
Okay, and Mr. Bell, last rebuttal on that.
Yeah, I don't really have too much of a rebuttal. I do think, I forget who mentioned it, but about the transformational change, and that is, I do think that that is the way that healthcare is going to go. And I know Tristan and I would disagree with the Maple App, but you know, I have talked to people who have said it's good, they've used it, and yeah, I do think that healthcare is making a transformational change.
Thank you. So we've concluded our first round of questions. I'll give the candidates a chance to catch their breath, take a sip of water. You want one more round of rebuttal? Okay, we're going to do one full round of rebuttals. I'm going to take the purview to do that. Please prepare your questions. There are still time. I'm looking at my clock here. We've still got time. So I'm going to go in the same order we just finished, just to keep things fair. Trying to be the fair moderator in the room. All right, Ms. Beaton, you get 30 seconds again.
I've been dying to respond to this. I challenge you to find Maple anywhere mentioned in our platform, because we say virtual care, but we do not say Maple. Frontline healthcare workers have been using a virtual care system for the end of time. You can ask Dr. Lana Beth Barkhouse at the end of the room. We have a system that our healthcare providers have been using, and it is the Conservatives that decided that they take the easy route and pay for Maple because it was already out of the box or whatever, they could use it. That's just another example of not actually listening to frontline healthcare workers, because they have the solutions, they've been using it forever, but it's falling on deaf ears. So I challenge you to look through my platform and find the word Maple anywhere. But yes, I do absolutely support virtual healthcare, because right now people need care. We have to be able to provide care, and if we can't do that in person, we have to do it somehow.
Okay, Ms. Carroll, anything you want to rebut from the whole session? I'll just give it an open rebuttal.
Well, I just really want to agree with what Michelle just said. Like, if, you know, there is ways that we can, it doesn't have to be Maple, but we've certainly looked at expanding virtual care in our platform, because, you know, one of our big ticket items in the action plan for the first 180 days is that if you haven't seen a doctor in a year, that we will make sure that you will see a doctor in that first year, but it will be virtually, because we can't bring doctors from nowhere, and you know, like there's a healthcare crisis everywhere, but we do have to have a sound recruiting practice. So I'm with Michelle on this one. I think that we need to use virtual care. There's all kinds of young people who really would prefer that, actually. Oops, sorry. I'm trying to talk like this, but I don't see it.
But then you'll make me ring my bell. I don't want to do that.
Oh no, not the dreaded bell.
Mr. Mitchell, a final rebuttal before we go to the floor.
You know, Mr. Bell and I were speaking earlier about the importance of having partisan politics put behind us and start working in a more collaborative manner. I will say, Michelle, I appreciate your passion on that, but you know, New Democrat leader Michelle Neal did send a letter to all of the party leaders for your party seat here today, asking if they would make a commitment to protecting our already existing public health care services, and not a single one of those leaders stepped up to the plate to make that commitment. So I'm concerned that innovation coming from any party might be a disguised word for privatization.
Okay, and Mr. Bell.
As I said in my opening remarks, I'm here to listen and hear, so I would love to hear the questions of the audience. That's my point.
All right. Well, let's go to our questions from the floor. And similar to the first format, we will give anyone who wishes to respond to the question from the floor 90 seconds. I'm looking at Judith. I think we can do that. We won't have any more rebuttals. We'll just do the 90-second from. I've done my rebuttals, people. No. We'll just do the 90 seconds, but there will be closing statements at the very end, so you can hold on to them for your 2 minutes at the end if you
And
wish.
people specifically pick who they want.
You can address it too, but everyone will have an opportunity to answer the question should they wish, if that sounds fair. So,
Okay.
and just maybe state your name, and if you're with an organization, you certainly can.
I'm just hoping if people want to come up and just line up, and then if anybody wants to ask a question, then you can go ahead.
Yes.
Hi, I'm Laura Lee Noonan, and I work in health promotion. So a couple of clarifiers before I ask my question. One being that chronic illness is different than chronic disease, so I think it's important that we make note of that. And from listening to each of you here today, there appears to be confusion around what is prevention and what is health promotion. It isn't about managing and treating already diagnosed chronic disease. This health promotion is about preventing the disease before it actually occurs. So we know chronic diseases are 100% preventable. They are caused by 4 modifiable risk factors, which include unhealthy diet, physical inactivity, tobacco use, and harmful alcohol use. So the best way to address these modifiable risk factors and address chronic disease is through healthy public policy. Taking one of these modifiable risk factors, what is one public policy you would implement?
So I'll put it to who would like to speak to that first, or I'll start picking on you. Ms. Beaton, okay.
Yeah, and thank you for the clarification. I really appreciate that. And I actually went into the Health PEI strategic plan and printed off where we stand today. And PEI has higher than national average rates in obesity and in smoking, and we're under the national average for activity. This, I'm not sure I agree that it's right, but anyway, it says that we're doing okay for heavy drinking. But I know, right? So, but I want to address smoking. And so, and I know the Chief Public Health Office came out with their sensation report to show how that has been working. And I'm actually going to address the bylaw in Stratford for healthy communities in order to make it smoke-free environment. So that is one place that has done a significant change in writing the bylaw. And now it's informing people about why it's not okay to be walking down a sidewalk smoking when you know you might have somebody right behind you that impacts. But what I also would say is the smoking cessation program is not prescribable by our pharmacists. And I've had respiratory therapists talk to me about them not being able to actually, not be able to prescribe. The challenge with that is whoever your relationship with is, they should be able to prescribe smoking cessations, let's be honest. But they should be able to go to the pharmacy to be able to get them. So one thing that we would change, a policy change, would be to allow pharmacists to prescribe smoking cessations.
Great. I'm going to go down the line, but I will switch it up. Ms. Carroll.
Okay, so we as well would allow physicians to take on way more responsibilities, and one of them would be smoking cessation. So, you know, there's a novel idea that's been presented by a gentleman here who has presented it probably to every elected official and everybody with any type of power for a long, long time, and that is to make PEI a smoke-free province. So, you know, we know how to do it. We know we can do it. We have the man who designed the plan. He's lining up to ask a question. So why, I don't understand why we're not doing that when we know what it costs our system and we know that we can actually be a leader in smoking cessation.
Great. Thank you. Mr. Mitchell, anything to add to that?
You know, when it comes to the unhealthy habits of adults and those who are at risk for developing chronic disease, you know, I think again, you know, where I touched on those health hubs, those are great ways to deal with that. But when it comes to the next generation, we have to think about making key commitments into investing in our kids. You know, class sizes across the country are growing, rural schools are closing, and with that, it's harder for teachers in our education program to keep up and implement new programs and ideas to promote healthy lifestyles and grow those habits at young ages. And I think, you know, we need to start right at the bottom, and that's, you know, in improving access for public health care and investing, public child care, I mean, and making it universal. Increasing the wages for childcare workers, and most importantly, where the Conservatives have failed, is getting education assistance a collective agreement, and making sure that that is a profession that is more available in the classrooms, so teachers have the resources to integrate better and more personalized programs for children. Thank you.
Okay, thank you. And Mr. Bell?
Thank you, Laura Lee, first of all, for the information. As I said, I don't claim to be an expert. The experts are around the room here, and sometimes it's important just to listen and to hear. I completely agree with you. I did not know about the smoking cessation, with the pharmacists, and I know with the Pharmacy Plus program, of course, they can always use a little tweaking and make it more better and adding that scope of practice. And I completely agree with any kind of activity to get kids active. Thankfully, I'm 44 years old. I was raised before cell phones were around. I'm raising an 11 and an 8-year-old daughter, and I oftentimes have to say, Sophia and Harrison, you know what, let's go do something. Let's go out, get on your bikes now that the spring is coming soon, now that the spring weather is here. So I completely agree with you. I do think like the one big thing would be trying to promote as much healthy living and active living. And I do think that the active transportation, that's one of the main things at almost every single door that I talk to is active transportation, make it connected, make it connectivity. I want to be able to get my bike. I want to be able to travel to work on my bike. Thank you.
Great. Thank you very much. I think we have another person for the microphone.
I'd like to thank Julia for putting down the microphone very appropriately. My name is Frank Orson. I'm a candidate for drug and tobacco-free public places across Canada. That's our goal, and we can do it. So just a little bit of background, and Michelle and Mercy have already introduced me, thank you very much. But I've been on the campaign trail for 52 years. It started in Surrey High School. Early in the fall, a group of students, and I'm going to try and credit them. Who's got the clock on me there? So I don't know if I have a red card or not. But
I got a bell, Frank. I got a bell.
What's that?
I got a bell.
You got a bell, okay. So I will be quick. But anyway, I'm going to give credit to as many people as I can tonight. And there was 4 young students came to me at the middle of October, and they said, Mr. Morrison, we had to be Mr. Morrison. Albert Fogarty was our principal. So, and I think people know him. Come with us, we want you to show you something. So I didn't know where we were going. We went to the far end of an old wooden school where the designated smoking room was. No windows, no doors, no way to get out except a long corridor. They called it the black hole of Calcutta. So that motivated me, this is wrong. So after Surrey, I went to Holland College in '74 and stayed there in '06. Okay. I totally get a question. Okay, just a quick background so the question will be easier. So smoke-free PEI in '06, and all these people, it was like old home week coming in here tonight. And when we started smoke-free PEI, you'll be surprised to know that our chairpersons were 2 doctors. We had Dr. Chason and Dr. Paul Larson, and Don remembers them. So that's how things have changed. Rec PEI, and I want to single out and thank Pam Hall and Gary McDougall coming with me 2,000 times as mentioned earlier. So we have all the support in place. I'm extremely excited to hear the coalition talk, and we're not in isolation. That's good. Okay. I'm getting prompts here. Okay, I will ask the question that the problem I want to explain, Michelle alluded to it, it's not enforcement, it's awareness. We have the bylaws in place, we have to tell people. So I had other things to say, but the question is, what will you people do tomorrow? What will your party do to make sure we are 100% drug and tobacco free in public places?
Okay, so I'm going to start with Ms. Carroll going down the line.
Well, I think I already said that, didn't I? Well, we support the movement 100%. I don't know about drug-free, but certainly tobacco-free PEI has always been something that the Liberal Party is interested in. How you go about doing it is another question. But we would definitely look into investing more money in health education, health promotion, healthy lifestyles, and you know, Tristan, my friend from the NDP, the paramedic, says that you know, maybe this could be going on in the school, but I think most of our education when we're younger comes from our parents, and we need to be able to create tools and pieces of you know, just takeaways and games that they can take from school to use to teach their kids about healthy lifestyles. So it's about promotion, action, meaning getting active, and maintaining that throughout your lifetime if you want to prevent, is it an illness or a disease?
Thank you. I am going to keep us moving, so I see a few people down here for a couple more questions. So, Mr. Mitchell, any comments on the request for smoke-free?
Yeah, I'll try to keep it a little bit quick
Thank
here.
you.
You know, I grew up in a generation where, I don't know the statistics off the top of my head, but I believe that the younger generations are smoking cigarettes a lot less. We're now seeing higher incident rates of vaping. You know, the programs that prevented me from becoming a smoker all occurred within the classroom and in the school system. And I think it's important that we look at ways to do just like what we did with tobacco, with the other, you know, unhealthy risks that are being posed to new generations. And again, that goes back to investing in the classroom, so teachers have the resources not only to bring in these programs, but as well to pay attention to students and maybe, you know, look at those who are more at risk, just like with individuals in healthcare hubs where, you know, we would like them to be referred to addictions counselors and specialists. We want children in our school system to be able to look at students and provide them with those same opportunities to get the help they need early and to get the education so that they're well aware of the risks that are posed to them by new things like vaping. Thank you.
Thank you very much. Mr. Bell, any thoughts on the smoke-free?
No, just one thing. A lot of people might not know this, but I actually dipped or chewed tobacco for almost 20 years, and it was near impossible to quit it. And I started doing it when it was on just a peer pressure. And so, Frank, believe me, I know firsthand how hard it is to quit. Michelle's probably seen me chew gum quite a bit. I'm 5 years off chewing tobacco, and I am 3 years off Nicorette gum, and I'm chewing off a lot of juicy fruit gum now. So I do agree with you. It's an incredibly tough habit. And both my parents smoked, and of course they stopped when they had children. So that's all I want to add to that.
Thank you. Ms. Beaton.
Well, this will probably surprise Zach, but I smoked for 12 years. And I started at a very late age and quit because I didn't want to be that parent standing in the smoking section of Walt Disney World with my little girl. Didn't want to be that person. So it comes with awareness, but everybody has their own reason to quit. And I think that we have to work with everybody. Enforcement's not the way to do it. Education is the way to do it. But we have to also remember, like, if somebody is seeing, if a child is seeing their parents smoke, they're more likely to smoke. And so we have to actually start in the homes, and it comes down to education. I know we have this conversation about chronic illness or chronic disease. I'm sorry now. Anyway, now I'm second guessing myself. But what I will say is, you know, one of the women that I spoke to who does have COPD, she's not supposed to be around cigarette smoke, but if she wants to see her granddaughter, then she's going to be exposed because her daughter smokes. And so if she wants to be part of the community, then that's a reality of her life, and we have to figure out how we actually function within the community. I don't have the right answer for you, Frank, or else, you know, there wouldn't be anybody smoking on the streets of Stratford because we already have a bylaw, but it definitely does come to education.
Great, thank you very much. We're getting close to our time, so with my candidate's permission, we'll take a couple more questions. I am going to reduce your time to 60 seconds. Does that feel okay? 1 minute to respond to the questions, just to keep things moving and make sure people from the community will still get our closing statements in. So, please.
Hi, Leo Shivery, and I know a bunch of people here know me, and I'm happy to be here. But I just want to make poverty is the #1 determinant of health. I think we make some great strides, but PEI has had the lowest wages in the country for generations, not just for the last number of years. And I've been pointing it out with lots of people over that time. But I see things like school lunches or very specific programs that might address healthy eating or things like this, because even workers at PEI depend more on food banks than anywhere else in the country in terms of getting their needs. But I'm also here because I'm living with cancer at the moment, and I just want to know, what are your party's plans in terms of two things. One, dealing with the environmental causes of chronic disease, including, for example, I know with cancer that there's a lot of things, whether it be nitrates or environmental other chemicals in our used by agribusiness or whatever. And also, what's your support for end-of-life care in terms of the really importance of investing in palliative care? I'll leave it at that.
Okay, so the two questions there, environmental causes and palliative care. So I am going to switch it up again. So I'm going to go to Mr. Mitchell first.
Firstly, thank you for the question. When it comes to the environmental causes, the climate crisis is upon us. We continue to be stuck using a very unsustainable form of energy production here in PEI. That really ties into our overall health, is our environmental health alongside other social determinants like wages and food security. And so, I think in the future we need to look at how do we tackle our energy system to make it better, not only for the climate, but more sustainable and protect our energy sovereignty, and that's really essential. And I forget the second part of the question there.
Palliative care services.
I volunteered with Dine with Dignity for a long time as a huge advocate for access to MAID. As a paramedic, I'm really proud of the strides that we've made in PEI for palliative care. I think that it's really important for us to focus on end-of-life care and ensuring that we're all comfortable in our time of death. Thank you.
Thank you. Mr. Bell.
Yeah, I don't really have too much to add, Leo. I do thank you for the question. I've never proposed to be an expert on either of your questions, so I don't want to just ramble things off. Thank you.
Okay, thank you. Ms. Beaton.
Great. So the special committee on climate change in the legislature came up with a lot of recommendations for how we're going to reach our targets, and agriculture definitely had a lot of some recommendations there. It's one of the contributors. And the reduction of using fertilizer and pesticides is absolutely part of that. I can't dig further into it, Leo, than that, but I do know that there was recommendations that we actually have to implement. And on palliative care, my dad passed away in 2020. It was the first time, Tristan, that I realized that we have an exponential number of paramedics in that back room because he was there with the palliative care team, paramedic team. And I realized at that point in time that very quickly you get into a situation where you're end of life and you don't even know you are. So really advocating for people to have health directives so that they can live out the rest of their life in dignity in the way they want. And it's a very sensitive situation, but we have to care for what people's decisions are.
Thank you very much. Ms. Carroll.
Yeah, so, around the environmental piece, there was some excellent work done by the opposition and the government around what are the big ticket items that are causing some environmental issues on PEI, and Michelle has referenced that report. I would go even more to the individual and and how do we stay healthy, not get chronic illness or disease when our food is full of chemicals, it's processed, it's full of salt, it's full of sugar, and when you're poor, that's all you can afford. Like a bag of apples now are $9, so that's really scary stuff. So I would say that we need to find a way to make groceries more affordable for all families on PEI, and I think we can do that. And when it comes to palliative care, I had the absolute pleasure of being with my best friend when she chose medical assistance in dying. I held her hand when the last breath left her body. It's still hard for me to talk about. But we must allow people who are ill to have autonomy over their end-of-life decisions the same way we want people to have autonomy over their lives when they're well.
Absolutely.
Thank you very much. Very much appreciated. I think we have another question? Yes. Okay.
Thank you everyone to provide us a wonderful opportunity to ask you some question. Like, I know I have only 60 minutes, but still I want to ask you a concrete issue that everyone is talking about the healthcare. Someone is saying that we have a huge shortage of doctors, medical professionals and everything. Everyone is aware about that. But I never find a concrete solution from any of party about how to fulfill the shortage of the doctors. People are saying that we can hire the doctors. Doctors will come and they once after completion of 1 or 2 years, they will again move to bigger cities. That's happening all the time. I have a solution also this problem. I know maybe somebody is talking about we can fast the licensing system to provide the opportunity international doctors they can work here. As per the facts, there are thousands of international doctors are in Canada right now. Most of are waiting for their licensing process, or they are stuck due to the complex licensing procedure. I know people are coming from Asia or other countries. They have lots of work experience on the medical field. They are surgeons, they are best physicians. But due to this licensing obstacle, they are not able to serve the Canadians. So I have some solution that instead of this complex licensing system, why can't we formulate a bridging program? So that a bridging program is that you can bring your international degree, spend 1 year, 2 years with our medical environment, and then start practices. Instead of going the long route where not everyone gets the success. And the doctors have already worked on the UN missions, so you can understand how much experience they will bring it for the Canadian system. Yeah. And I have another solution that if we do not have a medical schools, like overall Canada, we have 13 to 14 medical schools.
Just one question. Yeah.
Yeah, but it is related to that doctor.
Okay.
I know. But
so what's the question you'd like to pose to our candidates? That would be helpful.
My recommendation is that we have to prepare a bridging program, and also we have to tie up with the international medical schools, so that we can bring it for international doctor in an easier way. Many, if you see engineering colleges, engineering institution, they have a tie up with the other countries' institution.
Okay, so I was going to say, so frame the question. I think that what I'm hearing from you, which is absolutely, I think everyone in the room has agreed that we need more physicians, and you're identifying the fact that there are foreignly trained, physicians and health professionals, and what are the parties committed to doing to making it easier for them to be able to practice here? Is that a fair way to frame the question?
Yes.
And I think the candidates, a few have referenced that, so I'll just give a moment if any of the candidates would like to speak to that.
I'd like to speak to the medical school piece that he
Sure.
spoke about. Like, the Liberal Party is against a medical school. It will cost $200 million to build it. It will take 12 years before we see a doctor graduate from it, and we will pull 6 to 8 doctors out of our current system that is extremely in an extreme shortage right now to teach. But what we are proposing is that we would like to double the seats that when we currently right now we send residencies I should say studying doctors to be trained in Newfoundland and Nova Scotia. So we pay for their education. They don't have a contribution agreement to come back here and practice. We would change that right away. We would double the number of seats, from 5 to 10. 2 of those seats would be for newcomers or international students, and you would if we pay for your education at one of those schools, you have to come back here and practice as a family doctor for 3 years.
Okay, thank you very much. I'm going to go to Mr. Mitchell, and then I'll keep going.
You know, it's really unfortunate here in Canada. We have a bit of a Canada-centric system when it comes to medicine education for physicians, and you know, we do have a system that has way too many barriers. You know, I just met several young people from Mexico who were trained as physicians, came to Canada and are unable to do that, and now they're trying to enter our college system, and they can't afford to do the paramedic program where they might use some of their medicine skills and are, you know, opting for cheaper programs like a dental assistant. So I think, you know, we need to invest in our education and also reimagine it. You know, Canadian medical schools are extremely inefficient. You know, the acceptance rate to get into school and the numbers that they're pushing out are not enough to feed our system. You know, Europe has a much stronger model for outputting medical professionals, and you know, I think a medical school, which, you know, for here in PEI was brought about as a New Democrat idea, I think it's an opportunity for us to pioneer and reimagine the way that we do medical school so that we don't have to be reliant on mainland programs to put out physicians into our communities. Thank you.
Okay, thank you very much. Mr. Bell, and then we'll go to Ms. May.
Yeah, I didn't catch your name at the start there, but
My name is Lokesh.
Lokesh, thank you for the comments, and I'm actually interested in that, the bridging program. Yeah, I do disagree with Marisha on the medical school. I do think that, you know, one of the problems with where we're at right now, and Michelle talked about the motions before, I brought forward a motion too, and it was critical of government actually, because we didn't make the plans in place to help with PEI's growing population. And you know, I think that the infrastructure should have been put in place, or at least looked at. And I do think that the medical school will be something that, yeah, it will benefit us. I do know it's an investment, but it is an investment down the road. And I do think that in the you know, in the 10 years that it'll take, it'll come to fruition, that it will be beneficial for PEI.
Great, and Ms. Beaton.
Well, I'll just say that there's been a medical school committed to, $122 million, and there's not even a business case to support it. So I find that very difficult to support unless you can show me the numbers, and I don't think the numbers are there, to be quite honest. It went from $50 million to $122 million, and it wasn't even debated in the legislature. Like, that's not the way that our government's supposed to work. It's supposed to be value for money, and Islanders are supposed to be able to see how their money is being spent. But I digress. So we got an issue with licensing, our licensing body. It hasn't been overhauled for decades. The licensing body was set up to keep doctors out, and we're now in a situation where we don't have an abundance of doctors, we have a shortage of doctors, and we need to actually make them change their processes. Also on the family physician residency program, Marsha's right, 4 are Canadian trained, 1 is foreign trained. We should be able to identify the jurisdictions, international jurisdictions that we align with, and immediately open those up. But we need to actually increase the residency program to 10, 12, whatever it needs to be, because there are people that were 100 or 200 applications every year for that one spot. We have to increase it.
Great, thank you very much. We do have 4 other people looking to ask questions.
Thank you.
Thank you. We are going to move through these, so if you can come and have a succinct question, we will keep our answers to 60 seconds.
Yeah.
We are at 7:30, so I'm going to beg the indulgence of maybe 10 more minutes if we're good. Thank you.
Yeah, very good. Yeah, Sandy Slade, ADHD PEI. I just want to take a moment to recognize the work that people living with chronic illness are using to support one another that are living with a chronic illness. And that being said, what tangible steps would you take if elected to give those with lived experience a voice in your government and that your government will listen to? And what can you do to help people while they wait for support?
Great, thank you very much. I'm going to go to Ms. Beaton first.
Okay, sure, thank you. So first of all, I remember Marcia and I having a conversation when you presented at Standing Committee. You said nothing for us without us, and I think we need to adopt that in all policies. But we also need to ensure that funding is there for the organizations that are providing that community-based care. And whether that is ADHD, the ADHD adult clinic, which we know has helped so many people, but it's got a 2-year wait list, and it's a pilot project, like honest to God, just fund it. And fund it, let them hire people so that we can actually start supporting them. I don't know why we have to make community-based organizations jump through hoops to get money from the government. We don't make the medical school, we don't make UPEI, so why do we make our not-for-profit organizations that are doing the groundwork jump through hoops and spend way too much time trying to convince government that there's good value for money? We already know it, you've proven it, just fund it.
Okay, thank you very much. Ms. Carroll.
So enthralled by Michelle there. Can't fund those NGOs. It's not hard to tell I come from the NGO world. So the question, can you tell me the question again?
What will you do? Sorry.
Where is
while people are waiting?
While people are waiting,
okay,
what would you do to support them
yeah.
and ensure that they have what they need? Yes.
Yeah.
And give a voice.
And give a voice.
Yes.
Sorry, yes, that was the first part.
So-
What will you do to make sure that people with lived experience have a voice, and while they're waiting for supports, and make sure that they're there?
So I don't think government should make any decisions or develop any policies without talking to people with lived experience. And I have pounded my shoe on the table for 17 years so that people with disabilities' voices are heard at the decision-making table, that where the decisions are being made that directly affects their lives. That hasn't happened. And it took me 8 years to educate the Liberal government, and I'm a Liberal. So now I'm into a new situation, where conservatives and we're not being invited to speak or help make those decisions. One of the big examples of that is public transportation. They've created a public transportation system that's not accessible. So you've got people with chronic illnesses trying to get to doctor's appointment and they can't get on the $2 bus, right? Particularly if you have a mobility issue. She's got the red card up. Because I could go on about that one for a while.
Thank you very much. Mr. Mitchell.
As you'll know from here today, politicians can do a lot of talking and they have a lot of ideas from within their own parties. But at the end of the day, here in PEI, just like across this country, we have multitudes of amazing community organizations and NGOs representing a diverse array of groups, including people who live with disabilities, as well as BIPOC community groups, and those representing immigrants, refugees, and newcomers. When it comes to sitting down at the table with committees, with decision making, with deciding how to best invest our money, we need to make sure that we prioritize consulting community groups like the many that are here today to be involved in this discussion, because those groups know those people's needs more than anybody. So that, I think, is an absolute priority and a great question. Thank you.
Thank you. Mr. Bao.
Yeah, the exact same thing. As I said, I've taken 2 pages of notes here tonight from very good points that you all have brought up. So I agree with Tristan there. Very important to listen to you and to have your voice.
Great. Thank you.
Hi, my name is Adina. I'm also the candidate for District 9, but today I'm asking a question for myself because I suffer from fibromyalgia. One of the many things which I can do in order to manage my illness is to stay active and to do things such as going to the pool to reduce the stress on the body for working out. Now that's a major barrier for myself as a low-income family because I do not have access to those. I don't have access to a pool. I don't have access to a gym. What will you do to help people manage their illness outside of the health system?
Great. Thank you very much. And I'm going to go to Mr. Bell first.
Yeah, it's a great question, Adina, and first and foremost, thank you for putting your name forward. It's a big step, and it's so good. I talked to Aiden about that as well. I don't have a direct answer for you right now, and I think that is definitely something that should be looked at, because again, I don't want you to have to, again, I think we've talked about this all tonight, you know what I mean? Cost should not be the main barrier for someone to be able to, to be active, to be healthy, and I don't think cost. So I don't have a direct answer for you, but I do appreciate your question.
Great. Thank you, Ms. Beaton.
I was just looking for the section in there because, and thank you, Adina, because absolutely, you're 100% correct. And one of the things that we would do is work with municipalities to be able to provide a programming that would be free for people who know about it. But one of the big challenges that we have to make sure that we have is when we provide those programs, the people that need them actually know about them. So, that's an education plan that we would have to have in place as well. But I do know that many municipalities are trying to figure out how to better service their residents. But let's be honest, if you look, I know Stratford just had a $300 surplus in the budget that they just passed. So they don't have money. So we would also want to renegotiate the funding plans with the municipalities to give them more money so that they can provide those critical services for their residents, which they may not have available now based on the funding models.
Thank you. Ms. Carroll?
Yes, so that's an interesting idea, except that it might really vary from community to community what type of care you get or what type of services that you can offer. And unless, there would, but I do like the idea. So one of the most important things that I've learned from my 17 years of working with people with disabilities is that they actually are the most innovative and creative people in the world because they navigate a universe that is not designed for them. One thing I know as a universal truth, that I know my body, and you know your body, and you know your body better than any healthcare professional. So what we need to start to do is listen to the patient, and approach chronic illness from a social model, not a medical model, with the client at the center and the client driving the interventions that need to be taken to make them feel their best.
Mr. Mitchell?
Pleasure to meet you in person. Thank you for stepping forward to fight for better for our, collective community. I think it goes back to the other question too. You're somebody who's living with a condition that makes it hard for you to access a number of public services, recreational activities, etc. With the Paramedic Association of PEI, when I was the education director, I was trying to put on a conference, and it's happening now on May 5th, for diversity education. And I was looking for race-based data to look at healthcare and whether or not it's equitable and culturally competent. This data just simply doesn't exist. And you know what? There's not a lot of data out there as well, I'm very confident, for people living with chronic diseases and conditions like your own. And so we need to invest in, collecting that data and surveying people like yourself to understand how we can improve those services, because again, we can talk all day about ideas, but if we don't focus on the individual's voice who experience those barriers and challenges, we're never going to make actual changes that best benefit them, because your voice matters. Thank you.
Thank you very much. We have two last questions. Both have been standing there, and I'm going to make sure you get your question. My prerogative as the moderator.
Thank you. So my name is Jana Toms, and I'm here tonight as a parent and as a member of the community. I think one group that's often neglected is our youth who are living with chronic conditions. I have a 12-year-old daughter who her life changed dramatically last year. She's now 13 and living with a chronic condition, and has impacted every area of her life. So what will you do for our kids and our youth who are living with chronic conditions?
Thank you for your question. Ms. Carroll?
I think, thank you for sharing that story. I'm sure that's very hard for you to speak about in public. But again, what needs to happen is we need to have a medical system that looks at individuals as whole individuals and that we use a social model when we treat chronic disease or chronic illness. That means people say, oh, what's the difference between a social model and a medical model? A medical model is surgery, medication, diagnosis, and all those kinds of things. A social model is looking to your community, listening to that patient, finding out what her dreams and aspirations are, and looking at how we can make those things happen through various interventions, like yoga, like walking, like pet therapy, like art therapy, things that are treat the mind, body, and soul as opposed to just the body.
Thank you. Mr. Mitchell.
I really appreciate your question, and I think that children need investment now more than ever. When it ties into healthcare, our platform with community health hubs will be important to integrating a whole team of professionals to help individuals and families like yourself, but as well when it comes to just the day-to-day needs outside of healthcare and those children with chronic disease healthcare needs. When it comes to education in the classroom, right now in PEI we're just integrating these students who live with these conditions just into the normal classroom, and frankly I think that their education is suffering and they're not getting the supports that they need. We need more EAs, we need programs that are built towards children like yours, so that they can grow up and have their needs met in terms of education as well. Invest in those healthcare initiatives to create support systems that just better help you with all aspects of your child's life. Thank you.
Thank you. And sorry, I lost my order here. I think Mr. Bell's last.
Yeah, thank you very much for sharing. As Marcia said, it's probably a little bit hard to share that in public. And the thing that I would want, and I would want any government to do, is to help the family. I chatted with the family today, and it's not the exact same situation as you're in, but it's somewhat of a similar situation. And as the family unit, they're dealing with something new that they don't know, and they don't know their options. And so the hope would be that, kind of what Tristan talked about, that there is that support for you and for your daughter.
Great. Thank you very much. And our last question. Oh, sorry. My apologies.
I don't mind taking it.
I got a whole sheet here. I'm trying to manage the people. My apologies, Ms. Beaton.
I try stopping me. Thank you so much. And first of all, I would look at our education system. So I think when we engage children, especially, and talk about what health issues that children are experiencing, and we normalize it so that she's not alone. I know my daughter danced down in Montague, and she had a young girl with type 1 diabetes in her dance group, and that changed her life and her outlook of how people viewed her, and they also then wanted to support and wrap their arms around her. But also another girl that my daughter danced with, and she was actually a feature of the Eastern Graphics Through the Cracks, and she had cancer treatment. And that young girl, she's only 13 years old, said it was easier to get cancer treatment than it was to get mental health supports. And what we know is children who go through ACEs, adverse childhood experiences, which is what cancer treatment is, we know that they're going to face mental health challenges. And she wasn't wrapped around. She didn't have wraparound services around her. So I think that we have to actually address what we know. Oh, you're stopping me. This one's important though, 2 seconds. I think we have to address what we know. And when we're not providing the services for outcomes that we know are gonna happen, then we're failing society and the community. And so education and mental health supports and knowledge that we know when people need help. We just shouldn't make you fight for it.
Thank you.
And I just have to say that we cannot segregate children with special needs from the classroom. They need to be in the classroom with all the other students.
Okay, thank you. Last question.
Hi. Is that on? Okay, there we go. Hi, my name is Cordelia Hearn, and as a young person who lives with chronic illnesses, and for years I've had to travel out of island or out of province for healthcare for the specialists. And just recently I've only been taken on by a rheumatologist here on the island. I was just wondering about how you guys will address the long wait lists for specialists and the lack of specialists on island.
Thank you very much. I'm going to start with Mr. Mitchell. Start with Tristan.
Oh, sorry. Thought you said Michelle, my bad.
Oh, sorry. My words are getting, it's long. My words are getting lost.
So, without a doubt, Islanders should be able to count on having healthcare services no matter where they live. You know, we need to look at increasing incentives for hiring and retention, not only in our ERs and rural clinics, but for, you know, our specialists that we have access to here in PEI. We also need to think about how can we make those services that currently we ship patients to out of province for accessible here and options to keep people on island. You know, it's a real pain in the butt, literally, for people to sit on stretchers for 4.5 hours to go see specialists in Halifax and St. John. So, you know, the NDP team is committing to boosting supports right here on island by investing into resources and exploring options to provide better access. I lost even where the person who asked the question went, right over there. But, you know, again, it goes back to as well, you know, collecting data and surveying people who live with those conditions to figure out how we can better provide those services. At the end of the day, in politics, we got to do it from the ground up, and that means listening to the people who need the services that, you know, we're supposed to be providing.
Thank you very much. Mr. Bell?
Yeah, I actually kind of agree with Tristan on that. You know, I don't really have much difference in opinion from what Tristan had said there. So, yeah, thank you.
Thank you. Ms. Beaton?
I have lots to say. 60 seconds. Yes. So first of all, I think we should ask the specialists why they have a wait list. Wouldn't that be nice? And then provide them the supports that they need in order to decrease the wait list. I was speaking with a neurologist who said we asked for a nurse practitioner to take care of a patient segment so that would alleviate them so that they could then take on more patients, and Health PEI told them no. So let's fund the people that they need in order for them to reduce their wait list. But then I also want to address out-of-province medical expenses. Far too many Islanders have to travel out of province for medical issues, whether it be surgeries or appointments and that kind of thing. When we send out that letter that you're approved for surgery, we should just send you also a gas card and a bridge pass. Because talk about two-tiered healthcare, right? If you have to go off island to get medical treatment, we should pay for that, because otherwise people are declining that medical treatment because they can't afford it, and that shouldn't happen.
Great. Thank you. Ms. Carroll?
So one of the ways that we hope to address the shortage of specialists is that we train more doctors through the model that Michelle and I had just discussed earlier. But after they've come back and practice as a family doctor for 3 years, if they want to specialize, if we're in need of that specialty, we will pay for them to go back and specialize. So that's a lot, but those are long-term pieces. Short-term pieces, we will increase walk-in clinics and the range of hours of those walk-in clinics so that you can see a nurse practitioner or a physician that will determine whether or not you need to be tweaked in terms of your treatment, and then send those notes off to your specialists. And okay, she's got that card up. How did you get all your stuff in? And the other piece is that you have to be able to access primary health care when you need to. And so there's a whole lot of work that has to be done around that. And I don't think our current government has done that.
Great. Thank you very much. Thank you for sticking with us. We are going to give the closing statements. So each candidate will have 2 minutes. The cards will come up again for some closing statements, and then we'll wrap up. So Ms. Beaton, we're going to start with you.
Sure. First of all, I want to thank you all for hanging in with us, and I do see many candidates out there, many from my party, and that have helped me for tonight, like Hunter and Nick and Adina and Lannabeth. I want to say thank you for supporting me tonight and to help me, because let's be honest, We have people that are in our party that are running for, that have lived experience. We have people that have much different experiences than others, but also people that have been working in the system for a long time to try to improve it. That's a lot of experience, and I think that our platform shows that. Healthcare and the state of our community right now is not great. Let's be honest, and it has been decades of mismanagement and no planning that has gotten us here. And I have to be frank that if we want something different, we have to look for a different plan that's actually going to address it and that has the political will to implement some really difficult solutions. And the political will hasn't been there for many years. So if we keep voting the same way that we have over the last 2 decades, 3 decades, 50 years, go back as far as you want, we're going to get the same results. That's a proven track record. But I would suggest that you look at the platforms, the ones that address a holistic approach that has been informed by people who've spoken to us over the last 8 years of us being in the legislature. We've spoken to people working on the front lines and we know what they're asking for. We have people who've informed us that are housing insecure, food insecure, that don't have family doctors. Like, we're in a really tough situation right now and we really need to do something different. We have to stop working around the fringes and we have to do those fundamental changes that need to happen in order to support Islanders that they need and how they need to be supported today.
Thank you very much.
Thank you very much for hanging in.
Ms. Carroll.
Okay, so, you know, from a holistic point of view, again, the patient needs to be at the center of any intervention that's developed for them. So that's why the Liberal Party has come up with introducing an act that's called the Patients' Rights Act. So if you have actually waited longer than the standard time that is laid out across the country to see a doctor or a specialist, you will have a mechanism, or you'll have a legal framework that you can apply to that will address that shortage for you. Now, how that will all fold out will have to be determined in making agreements with other provinces for out-of-province healthcare. I mean, everybody is in a shortage and it's going to take us a while to get the doctors that we need here. You know, that's one of the pieces that we are looking at, because everybody in this room has a right to health care. And by the sounds of it, lots of us aren't getting it, right? 28,000 people waiting for doctors. The gentleman that I spoke to today, he told me he was told, and he has 4 chronic illnesses, the main one being epilepsy, that he will wait 9 years before he has a family doctor. So that's not good enough. And, you know, we just really have to be creative and innovative. And I don't think we can transform the system unless we talk to the users and tell us how to transform it. And then we have to have the political will of government and opposition to do that. Thank you.
Thank you very much. Mr. Mitchell.
I want to thank everybody involved with getting this forum put together. I think it was a really important forum, knowing the issues that a lot of Islanders are talking about and knowing how terrible the rate of chronic disease is here in our province. I think it was also a great way to see where the parties stand, but also where we all agree. I mean, you said it yourself, there were times you agree with me, and who thought Conservatives and New Democrats would ever agree on anything? And I think it's important to remember that, because going forward, no matter who gets elected into the legislature, majority or minority, we have to work together to get better results. You know, at work as a paramedic here in PEI, I encounter Islanders every single day who suffer with chronic diseases, and I find that individuals and families living with these are struggling to manage them in a ever worsening and challenging healthcare system. We all know at least probably one person living with a chronic illness, be it, you know, our parents, spouses, neighbors, cousins, and the high rates of chronic disease in PEI are an testament to the failure of decades of government inaction to invest in supporting the social determinants of health. And to create tangible change, just as Michelle said, we have to change who we let into our legislature, as many of our challenges have been created by politicians that are out of touch with the island needs. You know, I'm proud to be standing with the NDP team as we're making commitments to invest in fundamental improvements related to people living with chronic diseases. And a part of that plan includes investing island tax dollars into island needs to improve things such as childhood and childhood development, making life more affordable, tackling the housing crisis, fixing healthcare, creating jobs, and tackling the climate emergency. These speak for themselves and touch on the important aspects of the social determinants of health that we need to improve to create a better statistic when it comes to chronic disease in this province. I encourage Islanders to review our fully costed New Democrat platform and vote for our vision for tomorrow, because together we can create a better deal for all Islanders. Thank you.
Thank you, Justin. And Mr. Bell.
Thank you. I want to say thanks to Dawn. You did a great job moderating it. I want to say thanks to Judith. You did a great job on the keeping the time and also organizing this. And most importantly, I do want to thank everyone who's come out today to hear what each party has to say about each issue. Tristan had mentioned it. Tristan's a paramedic and an ambulance driver. I listen to, you see this on a day-to-day basis. And Laura Lee mentioned, like the first line that she took were chronic, I wrote it down, I'm sorry, I don't remember, but chronic illness and not chronic disease, right? Like, you're living this every day. You deal with people that are in this every day. And I've taken 3 pages of notes from this, and I really appreciate your comments. I really appreciate your ideas and your concerns. The thing that I do ask you, of course, I'm one of 27 PCMLAs in District 10, Charlottetown, Winslow. I do encourage you to reach out to your PC candidate in your area and ask their opinion on some of these questions that you've asked. And of course, very much like our other candidates, I do ask you to check out our party's platform at peipc.ca. And I do thank everyone for coming tonight, and I thank you for your time and attention. Thank you.
Thank you very much. That concludes our evening. Thank you to our candidates for being here and for staying longer. I may not have won the Moderator's Award for timekeeping, but I really wanted to make sure the people who took the time to stand up and ask a question had an opportunity to do that. So thank you, all of you, for coming, and I hope you'll consider everything you learned tonight on April 3rd when you cast your vote. So thank you very much.